Welcome to The State of Us. Real people with honest opinions and the future of responsible media. Here's your host, Justin T. Weller.
Healthcare is at the center of many Democratic candidates' platform, and according to a recent Wall Street Journal poll, 67% of registered voters support the general idea of allowing anyone to buy into Medicare. So the question becomes, is America's healthcare system a fixer-upper or a teardown? Why we're using this particular example is because The Upshot, which is a column in the New York Times, wrote a piece entitled just that, and I thought they used a very apt analogy by basically using a house to describe the current system, an old house to describe the current system. So we're going to break it down in terms of this, but before we do, why do you care? Well, I referenced before, 67%. Nearly 7 out of 10 registered voters support the general idea of allowing anyone to buy into Medicare. So this idea has gained ground, but there's a lot of nuance to it, and a lot of people have different plans in regards to what that means. For example, does everything go away and this is the only option? Do people get to keep what they want and also be able to buy into this? So there's a lot of different things going on, and to break this down, of course, we couldn't begin this critical conversation without
your friendly redneck liberal, Lance Jackson.
Yep, I think I can get my wife to listen to this episode.
Yeah?
Yeah, just like HGTV.
Okay.
That's her favorite channel. So, you're right up my ballpark with fixer-uppers.
We got the house.
Whether or not to demolish or whatever.
Mm-hmm.
Yeah.
Okay, so what I'm going to do is basically we've got 5 houses to take a look at, Lance. Okay, 5 different houses.
Man, it's usually 3.
It's 5.
On all the
today.
shows I watch, it's 3.
It's
we
5.
got 5?
5.
Okay.
So we're going to try to get
One of
through.
them's the current house, right?
We're going to try to get through 2. Yes, the current house. So I guess 4 new ones to look at, and we gotta examine the current house. So think of the healthcare system as a sort of weird old house. There are various wings added at different points in history, featuring different architectural styles. Maybe you pass through a wardrobe and there's a surprise bedroom on the other side. Some parts are really run down. In some places, the roof is leaking or there are some other minor structural flaws. It also is too small for everyone to live in. But even if architecturally incoherent and a bit leaky, it still works. No one would rather be homeless than live in the house. I really encourage everybody, because I think it's useful, Lance, for this one in particular, if you have the opportunity to go to thestateofus.org and look at the article, because the graphics are useful and I'll do my best to explain them. But looking at it is not the same as obviously just listening to me describe it. So what you've kind of got is this pink house with a blue roof. Most of the windows are boarded up. Some of the gutters are falling off. There's a tent on the roof that's entitled Short-Term Health Plans. And then there's this weird steeple thing going out the top that's entitled Medicare. And then on top of that, there's some spaceship looking things entitled Medicaid. And then the individual market is this weird, sideways looking hall. And then there's a church steeple on the other side of the house entitled Charity. And I don't even know what that thing leaning up against the front is. That's the CHIP program.
Looks like a big hockey. It's measuring tape.
Oh, it's a measuring tape.
You see that?
Tape.
You pull it out there. I think it's a measuring tape.
Okay. So yeah, it's quite the assortment of items. And
it starts with John Cougar Mellencamp's house.
And there's
little
tents.
Pink houses.
Yeah. And there's tents in the yard because not everybody can live in the house.
That's right.
See the tents in the yard?
I do see the tents.
Yeah. So it's in a little state of disrepair. There's some problems to say.
But it kind of describes our current healthcare system.
Right. It's a mishmash of all these different things.
The main house is the employer health plans, which, the most Americans have. And then you have, the additions of Medicare and Medicaid. And then the weird, individual market sits on top of Medicaid and Medicare, right? I mean, that's not.
It doesn't even look like it's
not
secure.
Even a spaceship. It's just kind of hanging on top.
It's just sitting there,
and that's kind of what we have, right? Though is a mishmash of, and then everybody's supposed to either have one of those or buy into one of those,
right? Or they don't live in the house at all, and they live in a tent outside the house. So, which is accurate because I think that
which
part
nobody
of it's
wants to acknowledge,
right? there's a lot of people who don't have health insurance at all. And part of what the picture is demonstrating here is the equivalent is those people basically living in the tent in the yard next to the house, while the rest of us typically live in one of the various parts, either the main house, which is, again, like Lance said, where most of us live, or in one of the additions. The Medicare edition definitely appears to be the largest edition. And I think it's interesting too, Lance. It looks like it's made of some kind of granite or stone, perhaps, probably signifying the longevity of it.
Well,
and
notice
also
too, it's decaying.
Yes.
There are chips.
There's chips in the stone, but I guess the steadfast way that it's become part of American society, so in other words, there's the main house, but clearly the most significant addition is Medicare, and it's built of what appears to be by far and away the most likely to last the longest. So that's the current system. Anything you want to add to that, Lance, before we look at the actual plans? We're not going to spend a long time on the current system because I think for most people, they understand it's a hodgepodge of a million different things that have been just added over time.
No, I think you did a pretty good job of talking about what we have, which, like you said, most of us already know about anyway.
Okay. So the next plan is one of the plans proposed by a current Democrat. And again, we're not going to say which one. The most limited Democratic plan, for example, would deal with the House's biggest structural issues. It would lower the cost of health insurance for people and fix some glitches in Obamacare's design. The home construction equivalent of patching the roof, fixing a saggy porch, and repainting. I would also add that when you're looking at the two different pictures, in addition to getting a new coat of paint, for example, all the windows have been fixed, and it looks like we've added window air conditioners to the house. So we didn't have AC before at all. Now we've got window AC, no central AC. And we've got all new windows, and the front porch is fixed, and there's no more broken windows.
And the short-term healthcare plans are gone.
That's right. And short-term
it's been removed.
Yeah, short-term healthcare plans are all gone, but everything else is pretty much the same. I mean, we've still got all the various with a weird spaceship on top and the big stone Medicare structure.
But like you said, the gutter's been fixed, the chips and the masonry are done. It's, as you said, been painted, but you also still have the tents in the yard.
Right.
So there's still people not being covered.
Still people living outside the house because there's not enough room in the house for everybody. So I guess my thing with this plan is it feels like a Band-Aid, I think, because it is. Yes, it fixes some of the structural issues. So the house isn't likely to fall down anytime soon. But at the same time, it mostly appears to be a superficial facelift, Well,
but it doesn't cost very much.
Right. Well, I mean, facelifts don't tend to cost all that much. Relative to
how many tax dollars do you want to spend,
items.
Right?
Yeah.
I mean, it's just like anything else when you're looking at the health care plans.
So benefits it's affordable.
How much money? Yeah, right.
From a tax standpoint.
Very much. I mean, it improves the current situation in that it streamlines it a little bit, tries to plug some of the holes and leaks and problems, but it doesn't cost the American taxpayer very much money.
Right. So before we tell you who it is, take a moment right now, and at thestateofus.org, you'll find links to our social media. You can let us know whose plan do you think this is? This essentially what we're calling a facelift with some essential structural improvements. So we're fixing the absolute bare minimum stuff. In other words, if we don't fix these things, the house may fall down, but fixing this stuff will ensure the house stands for at least another 50 or 60 years without totally falling apart. And we're making it look better, making the house safer, easier to use. So whose plan do you think this is? And Lance, whose plan is it?
Do I get to say?
Yeah.
Well, this is the plan championed by House Speaker Nancy Pelosi.
Yes. Which, not surprising, right? I mean, she's always struck me as relatively pragmatic, and I think this is a pragmatic approach. And it's not too complicated to get done. It's not going to be easy because any change is not easy, but it's reasonable to get done. And like you said, it doesn't cost a fortune.
And she's been in the House a long time. So she's seen these changes. She knows the historical perspective from which they've all been originated and where they've come from and what they're trying to accomplish, and is comfortable, obviously, with just improving them. And she knows some of the glitches since she's been there. And then as well, she's trying to not spend very much money because I'm sure there are other programs that she would like to spend the country's money on. And the pet topic that we haven't talked about in a long time, and I haven't heard anybody in the government talk about, and that is the budget deficit. Nobody's addressing that anymore. So not to get us off topic, but maybe she's got some budget concerns. And so she tries to improve the system we have without spending too much money.
The last thing that's mentioned in this that I didn't say yet was residents could remain in the house while such minor repairs took place. The important idea here being that it's because it's not a complete overhaul of the system, Lance isn't going to have to move out of the house, right? He can keep using what he has while the changes take place.
I don't know. The one time we put an addition on in our house, I wish we'd have moved because my wife still has nightmares about it. But yes, I know what you mean when you can still stay in the house. You can.
It may not be pleasant.
It's not always a good thing.
And it also notes the house would still be weird and there would still be some people without a place to live.
Oh, right. I mean, you still got a steeple on the left there and the spaceships on top. So.
Right. It's a very peculiar looking house for sure.
Doesn't really solve any of the problems.
Right.
That that the majority of us agree on.
It shores things up.
Right.
Okay. So, we've talked so far about the current system and we're using the analogy of an old house with a bunch of weird wings, to kind of put things in perspective. And I wish we could take credit for this, but it was the clever work of the Upshot in the New York Times. And Lance, we've added this new feature, right, several months ago now, where people can follow along and see the process that you and I are going through. And they do that by going to thestateofus.org, right? Because all the articles are linked there. But there's also some listen links as well, right? So if people want to see other ways to tune in, they can go to the website and click on the listen badges, right, for the respective app they want to use.
That's right.
And also on the website,
trying to make it easy for them.
You can find out more about why we're doing this. And we're going to keep talking about this because we got 3 more plans to get through, all of which are, they start to get more different as we go from where we started with the current house. So stick around for that and we'll be right back.
We are The State of Us. Here's your host, Justin T. Weller.
Healthcare is at the center of many Democratic candidates' platform, and according to a recent Wall Street Journal poll, 67% of registered voters support the general idea of allowing anyone to buy into Medicare. And that's kind of the genesis of what we're looking at today. Is America's healthcare system a fixer-upper or a teardown? And we'll, of course, answer that question at the end of the show. But in the meantime, we're using the analogy of an old house with a bunch of different weird wings to describe the current system and walk through various Democrats' plans to address it. So far, we've talked about the Pelosi plan, as this Upshot article has entitled it, which for the most part, Lance, I think is fair to say is mostly a facelift, fixing the most pressing structural issues. Next up, we're going to look at the next tier of healthcare plans. Now, there's a number of Democrats that fit into this, so in a minute, we'll give them all credit. Essentially, this plan would also patch the roof and upgrade the windows, as we saw in the last plan. But it would also put a big new wing, an expansion of the Medicare program that would allow more people to join, sometimes called a public option. So everyone living in the house can stay while the renovations take place, just like in the last one, though there might be some disruptions. It would cost more homeless people would now fit in, and some living in the weirder wings might move into the new addition. People would pay for housing through a mixture of taxes and rent. So what this means here, Lance, is basically when it's saying pay for housing through a mixture of taxes and rent. This is basically an analogy for discussing if you're going to move into the new wing, i.e. if you're going to use the public option of Medicare, right? So Medicare for all those who want it is kind of what this has been nicknamed. In other words, nobody's forced to do this, but if you want to buy into it, you can. And the way it's paid for is a combination of taxes, i.e. how we pay for Medicare now, and how we pay for Medicare now, a combination of out-of-pocket expenses. So it's a twofold approach, right? Taxpayers are fronting the bulk of the cost, followed by you fronting some of the out-of-pocket cost. So the thinking here being, as you can see, that we're adding a big new section to the house.
It's right on top of the house. It's another second, third, and fourth story that's equal to the Medicare wing, right?
Yes.
The Medicare edition.
And the Medicare edition gets, shored up. I mean, as you can see, because basically...
Well, it's the same thing as the Pelosi plan.
Right.
Plus, we're going to build this 3-story addition on top as high as the Medicare plan with a little portico out over the front of the house. So you're basically just adding an option that is as big as Medicare.
Right.
And you lose one of the 3/10 in the yard.
Yes.
So you're accommodating more of the people who aren't allowed to be in,
right,
or who can't afford to be in, to bring in. So you're bringing in more people, but you're adding a huge addition to the house, which, like you said, obviously increases the cost.
Yes. So you got a big new addition. I mean, it looks like to me, right, it's probably the nicest addition to the house.
Well, because it's the latest.
Yeah.
That
I mean,
happens.
not just that it's new, but I mean, it's, it's a nice, it's a white house.
Oh, you like box plans with the white paint made out of wood?
It looks very,
with siding instead of the concrete and the spaceships.
Yeah, probably. I mean, from a house standpoint, right? The house you want to live in. I don't think most people want to live in that spaceship thing up there. Interesting. They chose Medicaid to be the spaceship.
It looks pretty cool.
I mean, it looked, well, I don't know. It doesn't seem. Oh,
my house would be the box out in the backyard.
Did you notice, though, that up there, the individual market
is gone?
No, it's up there.
Is it? Oh, yeah.
But see, it's changed. Not terribly, but we've added some different windows to the individual market now. So the individual market doesn't get much, but again, kind of like in the Pelosi plan, we're shoring it up, right? So you've basically, what we're doing is you've still got the whole Affordable Care Act, and the healthcare marketplace, which still exists. You've got old fashioned Medicare for, those people when they retire, right? But then you've got the new Medicare option, which again is essentially packaged all in the same thing because it's just Medicare now and anybody can have it whenever they want it. You start paying into the system. And like Lance said, we accommodate a few more people because it's a little easier now to accommodate them because we've got more space in the Medicare edition of the house. But there's a lot of people who still are living out in the yard in tents. So who do we think this plan belongs to? And it's several people basically who are advocating some variety of this approach, right? No surprise, I think. The article has chosen to name this the Biden plan.
Correct.
But it's important to note that Mayor Pete Buttigieg, Julian Castro, Amy Klobuchar, Beto O'Rourke, and others may go a little further than what Mr. Biden's planning to do, but essentially are proposing some similar version of this, right?
Right. And as they point out in the article, it basically, the differences are how many people are allowed to move into the new wing.
Yes.
Because how many people, who's allowed to move into the new part of the house?
Yeah.
Are what qualifies you. And that's the difference among the 9 or 10 different people here in their plans is.
For some, it's everybody. Anybody can move into the new section. For some, it's no, you have to meet XYZ.
You have to meet these requirements to move in and others.
Right.
So therein then is the differences, but they all still create the new wing.
Yes. They all still build the new wing and they shore up the existing system. Okay. So we're moving on to the next one. We've talked about the Pelosi plan, the Biden plan, and the next one. This plan wants to tear down the weird old house entirely and build a dream home. It would be enormous and it would feature many wonderful amenities. When done, there would be no homeless people at all, and everyone's bedrooms would look exactly the same. The weirdness would be gone, but the entire old house would be gone too, which some people might miss. and there could be unanticipated cost over reruns in the construction. Some people might not enjoy the aesthetics of a modernista villa. While no one would have to pay rent, most people would have to pay more in taxes so the government could maintain the property. And again, there's several candidates actually to attribute this to, but basically what we've got from a picture standpoint, Lance, right, is as described, a modernista villa of sorts.
The dream home.
Well, yes, for some, right? We've got a pool outside. And you get a cutaway where you see there's all these bedrooms, right? And all the bedrooms are identical. And there's like a little grass terrace on top. And you've got these weird shaped windows that are very modern.
They're not weird. They're light efficient.
Okay. Light efficient. Anything else you want to add about the house? I don't think there's a lot else to add. I mean, it's made of some kind of masonry.
Right. There's no tent.
Right. No tents. Yeah. No tents in the yard anymore. So everybody's in the house, whether or not they want to be in the house, right? Everybody's in it. Okay. I mean, it looks nice, right? I mean, it definitely looks.
Well, it's not an eyesore.
It's like definitely more put together than the old house. It's very uniform. It's just one house. There's no wings, no add-ons. It's just one house. So my guess is if you've been following things at all, you probably have an idea of at least one of the candidates that we can attribute this to, right, Lance? And who's that?
Well, I think it's one of two.
Okay. I know.
The easy.
I know.
The
you
easy
want to give
guess,
credit where credit's
due. The easy
due.
guess would be Mr. Bernie Sanders.
Right.
And
that's the one the article titles.
That's the way they title it. But I think it's
Sanders
more
plan.
important to point out that this is very close to also what Elizabeth Warren has proposed to do with the healthcare system.
Correct. As well as Cory Booker, Andrew Yang, and Tulsi Gabbard. So this is all along those lines of basically.
So a total tear down and rebuild where everybody's allowed in.
Right. Well, no, everybody's in.
Oh, everybody's in. Not allowed in.
Yeah, no. There's no option.
You're in.
You can't leave the house.
Even though it may cost more than what
that's right.
your builder says, because that always happens.
Yes.
When you watch HGTV and they do a fixer-upper, there's always an increase. Oh, we can do this house for this amount of money. And it's like, oh, we ran into this problem and this snafu and, you know, it's rotted out here and the electrical system has to be rebuilt. And it always costs more than what they anticipated. That's the point of in this article as well is, yes, we're going to tear down and start over again, but we probably won't get it as cheaply as what the candidates are saying we will.
Well, and people are used to the weird old house, right? I mean, to an extent.
Well, sure.
I mean, you know, we've all probably seen those houses, or we know somebody who's lived in one of those. I mean, Lance lives in an old farmhouse that you added on to, right? That you've made tweaks to over the years.
Yep.
And that's part of what makes it home, right?
That was the allure for me.
Okay.
Not so much for the missus, but that's the allure for me. Yes.
Okay. The eccentric nature of the house. So definitely a difference. And now the last one that we're going to look at here is a proposal that also wants to tear down the old weird house, but doesn't want to make everyone live in identical bedrooms. The dream arrangement involves more choices, but most of the basic architectural features would be very similar to the Sanders plan. They would eliminate nearly every part of the existing health insurance system and set up a new universal Medicare program that includes options from private insurers. It's like a housing development with several slightly different model homes. The basic architecture and amenities would all be the same, but families would be able to choose some custom options like paint color, countertops, and bed linens. It would also be expensive, and everyone would still need to move.
Yep. Bottom line is you got to move.
Right.
You can't, if you like your old house, you can't keep it.
Yes.
Or any part of it.
In the Sanders plan and this one that we're talking about right now, I mean, we're talking about tearing down the house. So you definitely can't live in the house while the house is torn down, right? And obviously you can't live in it after it's torn down. So you've got one option, which is to move out. And then in both cases,
I got that song running through my head.
You have to move into the new house.
Tearing down the house. Our house.
So what do you think about this one?
I don't like that. I don't like tearing down old houses.
Really?
Yeah.
Yeah.
I just, that's kind of what it is not as, aesthetically, pleasing to the eye
No.
as any of the other houses. I mean, it's almost as convoluted as the old house with all the additions is when I look at it.
Right.
Which is the point. It's like, well, there's something for everyone in this house.
Right.
And
it's just a unified architecture with all these different pieces.
Which then makes it, not necessarily very pleasing to the eye, just like the original house with all the additions.
It's kind of like if you go to like most modern apartment buildings, right? I mean, the outside of the building is all relatively uniform in its appearance. And then inside there's different floor plans. And I think that's the easiest way to describe this one. We're still tearing down and building a new building. Yeah, but this looks like a
Lego project gone awry.
Okay.
I mean, it's got some.
You really don't like this
hanging.
one.
I really don't. No.
I think it's just a picture.
And I think it is partly. And I think it also justifies my feelings about the candidate whose plan this is.
And what candidate is that?
I kind of feel this way about this candidate.
And what candidate?
Well, this is Miss Harris from California.
Oh, okay.
This is her plan.
So this is
all by herself, I guess, according to the article.
That's right. There's nobody else. Well, because I guess to me, this kind of
Kamala Harris.
Yeah. I mean, that's how I say it. That's how I've heard it said. To me, this is, we looked at Bernie's plan and we wanted Bernie and Elizabeth Warren and Cory Booker and Tulsi Gabbard and Andrew Yang. We looked at their plan, right, of tear down the house and build a new one. And one of the big problems we saw, which in fairness is a big problem, is the lack of choice, which Americans at least are under this perception that we like choice, right? There's been lots of studies done where that's not actually the case, and most people don't actually like having lots of options. Right. But we think we want lots of choices. We don't like the idea of not having choices.
Well, and I think too that everybody sees that there are problems with the issues. I mean, the majority of people, okay, there's a problem with healthcare and we need to fix it. But you know what? We need to fix it for you or for them. I don't need to fix it for me.
Yes.
I like mine.
So I think her plan is this attempt to say, what we really need to do is tear down the house and start over. But I want to basically kind of placate some people by
I'm going to ease your pain.
Right. I'm going to ease your pain by kind of creating some options, right?
It's like you dealing with me with technology.
Yeah.
You're going to just give me a little bit at a time, and then I'll come on board until you just totally change all of it. And then I got to learn all over again. But this is the kind of thing. You can keep what you have, but we're going to move you towards where we really want you.
There's different floor plans, but they're all the same square footage.
Right.
And you've still got the shared
amenities. And they're all going to accomplish
amenities.
the same thing. And you don't really get to do
anything
what
different.
You've always done.
Right.
But we're going to make it feel like you do so that you'll gradually accept the new healthcare system that's going to be coming down the road.
Is America's healthcare system a fixer-upper or a tear-down? We're talking about this, Lance, because of our mission, right? And what is that mission?
Well, our mission here at TrueChat is to educate people by providing honest, open, and respectful conversations.
Kind of a little different take today, right? With this analogy of an old house and what to do with it. And what we're going to look at in the last bit of the show here is, what is Lance and I's plan, right? We've heard of all these different plans. Which one are we favoring? Is there one that we like the best? And in order to find out, you'll have to stick around. Remember, if you want to look at this article, thestateofus.org, thestateofus.org. Is America's healthcare system a fixer-upper or a tear-down? You're about to find out, so stick around.
We are The State of Us. Here's your host, Justin T. Weller.
To understand the competing Democratic health care plans, consider an elaborate home construction metaphor. I guess this is a metaphor, not an analogy. I apologize. I got that wrong in the earlier part of the show. I always get them confused.
I didn't want to correct you, though, because you were on a roll.
That's right. Yeah. Is that it, or did you just forget?
No, it's like Animal House. You know, John Belushi.
So it's not that you're getting old.
Oh, no. I knew it all the way. But when John Belushi says, when the Germans attacked Pearl Harbor, when they're getting ready to do the parade scene, and they say, wait a minute, he'd get that wrong. No, he's on a roll. Let him go. That's the way I was looking at you. You were on a roll. I was letting you go.
Don't mess with it.
I was letting you go.
Don't mess with it. So we've looked at so far.
Feeling behind your argument.
Using a metaphor of this old house with all these wings, right, to discuss the various plans proposed by different candidates. We looked at the Pelosi plan, the Biden plan, the Sanders plan, and the Harris plan. And yes, there's other plans than this. A lot of these candidates got grouped together, particularly in the Biden plan and the Sanders plan, because those are the ones that most candidates seem to favor. So what we're going to look at now is what Lance and I have proposed in the past. Mm-hmm. Do you want to start us off, Lance? Because we did a spinoff of this program called the War to Save America, right?
Yeah. We've talked about this a lot. And I guess the reason you're hearing me grunt and groan about this is because I'm having a real problem with this now. I thought I had an answer, and
we both thought we did.
And I really don't like where we are now.
Yeah. Well,
and that's because personally, we're going through insurance changes. The insurance I'm retired, but I'm still insured under my wife's program at work, which was my insurance for many years. And they're making changes that I don't really like. And if I take my retirement insurance, it's going to be so much more expensive. And I don't really like what it is either. So I kind of like having the employer-based insurance because it's been really good for the last 30 to 34 years.
You've gotten used to it.
And I've gotten used to it and I understand it. But now the whole process is changing and the paperwork and even those options that we used to have that were really good aren't as good as they used to be. And they're costing more and more each year. So now I see the value of changing, but I don't like change. So I'm really in a conundrum. I mean, we've talked about some things and some plans that I thought would be good.
Yeah.
But I was always one of those people that said, I think the change is necessary, but let me keep mine. And now I don't think I want mine either.
Yeah.
So I'm in a real conundrum as to maybe it's time for a total teardown. So I've been repair and fix and put some new features in kind of guy was where I kind of felt it. But I'm almost now it's got to be torn down and started over. But I don't think that's going to happen. So how's that for you?
Yes.
Am I straddling both sides of the fence pretty well?
Yeah.
I mean, I just don't think as the American public and in U.S. politics, we're going to get a total teardown and rebuild.
I don't know. 67%, Lance. 67%.
Say they want what?
They say that they support the idea of allowing anyone to buy into Medicare.
There you go. That's not a total teardown.
I know.
That's not a total teardown, but I think that's where I'm headed is that I think we just need to totally scrap it and start fresh.
So let me remind people, okay, because it's been a long time since we went over what our actual plan is. It's none of these, okay, that are mentioned. It is none of what is mentioned. None of them are the exact same. Essentially, what we propose is a Medicare for all who want it option with, okay, so it's the Medicare you know today. Anybody can have it, okay, that wants it. I mean, the general thinking was that you're auto-enrolled in this, okay? So everybody has it by default. Now we'll talk about the transition.
And then you can opt out of it.
Right. And then you can opt out.
But the reason we came up with it and I supported it so strongly was, as you pointed out very eloquently when we were doing that show, was that it's the most cost-effective plan we have.
Yes.
As far as
administrative costs,
the costing, what it costs to implement the system as to the coverage you get is the best run system that's out there.
Yes.
And that's what sold me on it.
Yeah. The administrative costs of Medicare are, I guess we don't have access to every country's information, but the administrative costs for Medicare hover around 4% of total expenses related to Medicare. In the private insurance industry, they hover anywhere from 25% upwards of 50% administrative cost. And that's a huge part of what goes into what you have to pay. So the thinking here was, because if you listen, you know that Lance and I are about competition, right? And that often private companies can do something better than the federal government can, right? Typically, if they're properly incentivized. So what we want to do is open it up to everybody, auto-enroll them, but we're not going to prevent private insurers from existing. You can opt out if you want. And the whole thinking is here, it's going to force private insurers to either come up with something better or go belly up.
Right.
Because those are the only two options.
Because why are private companies at 25 to 30%, and Medicare can do it for 4 or 5. You know?
Right.
So you want to stay in business, which we're all for capitalism, then you find a way to do it as cheaply and provide the services that we can do at 4%.
Yes. And auto enrollment.
Or if it's going to cost me more, give me more services.
Yes.
Correct?
Exactly.
I mean, it's okay.
You can go above and beyond.
If I want to pay a higher premium, then I should get
better service.
Okay. All right. And we're okay with that.
Yes. Now that
because
was
some people within that total rebuild would not be.
Right.
They're saying, no, everybody's got to have the same coverage.
And that's where
we're still
headed.
saying it's still okay.
Right. You still have a choice. The thinking behind the auto enrollment, right, real important there, is that's what keeps it overall cost effective for 2 reasons. Because you need young people to automatically have been enrolled. One, because they probably won't enroll in any health insurance on their own.
And the more people that are in,
and the more people there,
typically
the lower
lowers
the cost overall.
Right. That's the way that works.
And the other side of that is it makes sure that every American by default is insured. And the only reason that you would ever not be insured is if you chose not to be insured, which you have the ability to still do, which I think is important.
See, I really don't like that.
The option to not, but an important caveat that we mentioned as part of this plan is this whole, the way it works right now, right, is if Lance is in a car accident out there and he has no health insurance and he shows up at the hospital, they are required by law to treat him even if he can't pay.
Right.
In our plan, that's gone. So if
I knew there was a reason I liked it.
That's right. So you're welcome to opt out, but understand that opting out means
society doesn't have to take care of you.
Society is not obligated to take care of you.
We are cold-hearted, aren't we?
Well, everybo's enrolled by default.
No,
which is pretty
I get
generous.
it. I get it. I'm just all those people out there saying, really, you guys? No, we're covering you.
If you consciously
choose
you
coverage, if you choose not to,
in,
then you shouldn't get both sides of the coin.
Right.
That's just not right.
It's not our job to pick up your bill if you choose not to be part of it.
Exactly. We're offering to pick up your bill.
Right.
But if you don't want us to pick it up, then we're not going to pick it up.
Yeah, we don't just pick it up whenever you feel like us picking it up. And I think that's the key in this plan. So that's an important caveat to understand. Again, all of this is where we're going. We had a whole transitionary thing that has to take place to get there because we don't want everybody to just be, blindsided by this whole thing. And we don't want it to be a terribly painful process. It's not going to be easy no matter what we do. Even the Pelosi plan, right? Even just the minor repairs and tweaks, it changes things, which means that there's new things people have to learn. So it's not painless.
Well, and there's cost involved.
Right. In everything.
I mean, at some point, and I know I've tried to bring it up earlier in the show and it's not what we're talking about, but at some point we're going to start talking about how much everything's costing and what the budget, what the deficit is. Because it is going to become,
but we pulled Americans,
it is going to become
right?
a story again.
And that's like a non-interest item.
Right. Well, and nobody's talking about it.
The debt doesn't matter, Lance.
Even the Republicans that was all they could talk about for 8 years.
It doesn't matter anymore.
I know.
Who cares? 22 trillion?
You and I do.
We talked about the whole,
because we know debt's not
our
good.
total net worth as a nation.
Right.
Versus debt. Now, right now it's still okay. I mean,
but let's not get sidetracked. Don't let me sidetrack you. I'm just saying, even under the Pelosi plan that doesn't do very much, it's going to cost more.
They all cost money.
Right.
And and here's the thing. Anybody who tells you they know for certain, right, is not telling you the truth when it comes to the cost thing here. Because as it points out at the very beginning, any change is going to have unanticipated consequences that we just can't foresee.
Just like when you're building a house or a repair on a house.
Something will happen.
Anything.
And it may save us money. It may cost us money. We don't know until we do it. So the real important part of this being that we have to understand going into it, that there's going to be unforeseen things. And the more of a groundwork that we've laid to keep the system simple, but also make sure that long term we're thinking about how it will be paid for, the better. The biggest problem that I have with the completely tear it down and start over, which again is not what Lance and I are proposing. It's semi what we're proposing. But the biggest problem with that I see is this whole idea that there's basically no plan on how to pay for it. I mean, yes, increase taxes, but there's no specifics on how much are we going to have to increase taxes to pay for it? Because if we're going to have to pay 50% in taxes, all of a sudden there's a lot less people, I think, who are going to be interested.
Who are supportive of it.
Right. Exactly.
It was like everybody who wants free college. It's not free. Somebody's going to pay for it.
Yeah.
And people who say when they get the bill for how much they're going to have to pay for it. You know, obviously, if you're not making anything, you don't care how much taxes go up because we're talking about income taxes.
And that's part of what I like about our system, because that whole idea of if you opt out, right? And in this case, if you don't pay into the system doesn't take care of you. You know, now there's exceptions because we've talked about.
I mean, that fits my libertarian views.
Mm-hmm.
You have a choice.
Yeah.
If I want to go off the grid, I can go off the grid, but then I can't jump back on the grid when it benefits me.
Yeah. If you show up in the emergency room, the hospital has the right to expect you to be able to pay, you know, if you've opted out of the system. If you're in the system, then it's no problem because everybody carries the system, right? And you know, because there'd be a centralized database, any hospital could look you up with your driver's license or your social, and they'd see you're covered. And if you don't show up, then they know you're not covered, and they're happy to treat you as long as you're prepared to pay what it costs to treat you. Because otherwise what happens is they just have to eat that, which raises cost, which in essence transfers that to Lance and I, who have already chosen to be in the system. I still think, Lance, and I don't think it's just because we came up with it. I just still feel like that's the best option because it respects the idea of letting capitalism do what capitalism can do, which is create what we would hope in all of this is 50 years from now, nobody would be in Medicare, you know, or very few people, because what would happen is private industry would come up with so much better options than Medicare.
Well, it would hopefully get healthcare costs under control.
Right.
With private industries and the drug companies and everything
they would
else,
innovate
so that they could compete.
Yes.
Because we're going to force them to compete in a situation where right now there isn't a lot of competition.
No.
And we believe that competition is the best thing for everybody involved.
Right. It should yield lower cost, better plans, and a more efficient healthcare system by the government stepping in and saying, you know what, for a while, we're going to take over. But people don't have to be part of us, but everybody is going to be by default. So now we've shifted it back to the insurance companies saying, if you want people, you have to convince them that what you have is good enough to leave what they have right now, right? And go sign up for your thing. You have to convince them they want change bad enough. And that really is going to force some innovation, and it'll definitely trim back the market for a while. But the hope long-term is you'd ultimately end up with a much better system, and probably a system that's mostly private companies again. Just the difference is there's always that kind of safety net of Medicare there so that, you know, people can opt out. They can go with these other plans, but it keeps the insurance companies accountable, knowing that if they ever let themselves get out of control, they'll be able to quit pulling people away from those enrolled in Medicare. So that's the thinking. Let us know your thoughts. thestateofus.org. thestateofus.org. Remember, we're going to be releasing a new feature where you can see Lance and I's current reading list. We're trying to open up the transparency into how Lance and I arrive at what we're discussing, because we don't want it to be in a box. And that's why you can read the articles now, and you can check out our reading list to figure out how we arrive at what we arrive at. So thestateofus.org. Also there, Lance, all the different ways for people to listen, correct?
We've got Stitcher, Spotify, Apple Podcasts, and anywhere else fine podcasts are found.
Because this whole idea of the state of us, this experiment that we call the state of us, only works, right, if we get more people involved. Because the way that we came up with this plan was by looking at a bunch of different plans and then coming up with our own. And if you look at our plan, you'll probably find some holes in it and some ways to improve it. And that's ultimately what we're after. And spreading the information that a lot of mainstream media is ignoring. So be sure to share it with somebody, encourage them to tune into the State of Us. We greatly appreciate it. For the State of Us on TrueChat in Urbana, I'm Justin T. Weller.
And I'm Lance Jackson.
Thank you so much for tuning in. We'll see you next time. Be the change.